What do you mean by define the territory in case taking?
Yes, it's mentioned on the scheme that the case taking takes mostly place in 3 more or less separate episodes. And the first episode is defining the territory. Yeah. The second part of the interview I call more of the same. And the third is confirmation. So defining the territory is very important. And it happens by the patient. Let that be clear. Let that be very clear. The patient comes in, your question is, what can I do for you? Why are you here? And then patients start talking. And some patients start talking for a long time, you know that. And we let them talk. Others need a little bit of encouragement, like, yes, I understand, can you tell a bit more? For instance, they come in and they say, I have headache. That's not enough, that's not the territory. It's already something, it's the main complaint, but we want to know everything about the main complaint. So the answer the patient gives in the beginning of the consultation is the topics we are going to talk about the rest of the consultation. That's a territory. Whatever it is. If the patient starts to tell about his situation, about his life, about what happened to him on his way to the homeopath, or he starts with when I was born, whatever, or he just limits himself to the physical complaints, that's a territory. We're not interfering. We are not deciding whether the territory has to have all levels or have to have all, how to say, the history of the patient. It's not to us, it's not up to us, it's a patient who decides. So in that case, we will not mistake, if it's a monera, he will talk about disease. And the territory is disease, nothing else. It's very clear. Sometimes somebody walks in and says, I have a few complaints. I have sleepless nights, for instance. Okay, then we know that's level 2. It's a functional problem of the 2nd level. I suffer from beginning of arthritis. I have painful joints. Okay, level 1, it's physical problem. And well, maybe I would like to be a bit more, you know, certain of myself, because whenever I go to my job and with my colleague, I always feel I'm overruled. Okay, that's the territory. We have 3 topics, one on level 1, one on level 2, and very important, not my fingers, not my sleep, but me. I suffer from, in relationship with somebody else, that I feel overruled. And that will be the territory. Of course, we ask a little bit more. What about your fingers? What about your sleep? What about your colleague? To check if there's something else. It could be that it's only the first step and will lead to something else. But if not, we asked. We ask the patient, something else? Anything else you want to tell us, or you want to become better, or you want to get rid of? And sometimes they said, yeah, I have something else. Sometimes, no, that's it. That's when, you know, the territory is defined. They have put the sticks, and within this fence, there is the treasure, and the treasure is their simillimum, is their remedy. And you know, it's within this. This means, very literally, we don't have to discuss anything besides or outside this territory. The patient can talk of many other topics, but the vital will be within, because they didn't choose this by accident. They don't know, they define the territory, but we know by experience that we say, what flows from the heart comes out of the mouth.